Hi guys, Kiana and Sonette back at you with another video. Today I'm just going to be telling you a little bit about what my first week of being in a new grad RN residency has been like. This is for my future nurses or nurses even that are in the phase that I'm in that just want to see someone else's experience. So let me tell you a little bit about my background. I graduated nursing school from an accelerated BSN program in August. It is now November, so it took a little bit of time for my residency start date to get here. I started October 21st, and ever since then, I've been considered a new grad RN. So let's get into it. So usually your first week of being in a new grad RN residency program doesn't really count, and the reason why is because you have to get orientation to the hospital and to your floor. So that's usually what the first week is about. So my first day I went to hospital orientation and I got to learn your background about the hospital that you're working at. You want to be knowledgeable about the place that you're working at, including the history of the organization that you're working for. You want to be aware of how many hospitals are in your hospital system, where to find things, resources, things like that. They also went through, the company culture, what is expected of us as far as how we treat each other, how you're expected to act as a nurse in general or as an employee of that organization will be communicated to you in whatever way. They also introduced us to all of the leaders of the hospital. So your CEO and, directors, things of that nature. Then there's patient service orientation or, some type of orientation directed directly towards the nurses. And that's basically you learning about basic infection prevention, who you can speak to about your benefits, because now you're an employee. Look at us, we're official. And then like workplace violence or harassment, things that a usual company would go through with you. So that's your first week of orientation. Then you get oriented to your specific floor. And so my floor is the cardiac ICU. So that's the floor that I got oriented to. And so you get on the floor and they will give you a tour of the unit. You want to know where to find everything in case of an emergency, such as like the code blue button, how to call a code or any type of medical alert, or if there's a security event, you need to know how to conduct yourself during a time like that. So you'll get oriented to your floor in regards to that. You need to know your way around a patient's room, the controls on the bed. Every basic thing that you might have just learned in nursing school will be reiterated to you. So, when you were in nursing school and you were doing clinicals and the nurses say, hey, we're gonna teach you how to be a nurse once you graduate. So it's kind of like that. They just are really thorough in making sure that you feel welcome and comfortable on the floor, or at least your new grad residency program should do that. You usually have somebody that you report to, some type of educator or director that's in charge of your onboarding. You do have to complete all of that paperwork as well. Definitely make sure that you are prepared to stay organized. You need to have multiple notebooks to fill out information. I have a notebook that I fill out information in general for my unit, and then I have one that's specifically for education, because you're going to be learning specific education based on your specialty, and you want a notebook almost like you're in school again, but this is a little bit more specific to devices, procedures, policies that's going to be on your floor. So you want to make sure you're extremely organized and you can find information when you need it. And you also want to make sure that you come to your residency program prepared to learn. So you want to be taking notes about everything, because you're going to be overwhelmed with a lot of information. Everything's so new to you and you're going to want to remember it. Something just as simple as, a specific nursing protocol to do in a specific event. Out of a million things that they're going to be teaching you, you want to be reviewing the note taking that you're doing consistently. I'm even going to type up a little fact sheet for myself just based off of the first week, because I feel like you learn a lot of very important information your first week that you don't want to forget. And you don't want to be bothering your preceptor about things that they've already told you. Like, it's just not fair to have them keep repeating themselves when their job is to teach you as much as you can learn. So once you're oriented to the unit, then the fun stuff starts. You're gonna have anywhere from 24 to 36 hours each week on the floor, so you'll be clocking in like a regular nurse. And then you'll have another day or another 2 days, depending on your schedule, of residency classes. I haven't started my first residency class yet because it just hasn't come up on my schedule yet, but I've been on the floor. And when you're on the floor, it's a lot. So I can only speak to my floor specifically. As far as my specialty in the cardiac ICU, everyone's experience is going to be different on the floor. But your schedule will pretty much be like that on a weekly basis. You'll have 1 or 2 days on the floor, and then you'll have 1 or 2 days in your classes. In your classes, you're gonna be learning, like I said, specific procedures, specific devices, protocols that are on your floor specifically. Especially the most common ones will come up at first. And then you're gonna go through a whole bunch of modules. So your learning never really stops. Don't think that just because you graduated school that you're not going to you're basically going to be in school and working at the same time during your new grad residency program. So just approach it with a smile, be extremely positive, and make sure you're well rested and that you're always eager to learn. What else? When you're on the floor, the cardiac ICU floor is what I can only summarize, I guess, what I've experienced so far. And what I've experienced so far is that there are a lot of drips, a lot of pressure to make sure that your charting is on point, that you're very detailed in your assessments, and that you're on top of making sure that you meet your patient's needs. So I won't get too specific into that because that's really specific to your floor and what their goals are, you know, as far as what they want to focus on to improve for their floor and things like that. But I think I've told you guys enough information. Stay tuned for future videos. I'll definitely do a more in-depth video on what it's like to be in the cardiac IC unit specifically, and I'll also update you guys on what it's like to be in my residency program after like a month. So thank you guys for tuning in, and I'll see you on the next video.